Omo, the prevalence rate of hepatitis don't dey very high as I dey tell you. No be lie o, lie no sweet. If you go hospitals now, go see people wey don dey down with the virus, like e don reach chronic stage, wey be say they don dey down. Na you go really understand wetin I dey talk. My brother and my sisters, dem dey for excruciating pains. So the last time wey I go hospital come encounter hepatitis patients, I decide to go make research. I come find out say federal government through federal ministry of health talk say 20 million Nigerians dey infected with the virus. But personally, I believe say if dem do more survey, like say dem say make the entire population or even half of the population of Nigeria, make dem go run tests, that statistics go dey higher than that 20 million. But the funny thing about the whole thing be say hepatitis na one kind sickness wey, for me, I believe say hepatitis pass HIV, wey dey even look say na im be the ogbonge sickness. Why I talk so be say I find out say hepatitis dey 50 to 100% more infectious than HIV/AIDS. And one thing about am be say if you don get am, you can only manage it. The treatment wey you dey get na just to manage am. But if you test and e be say you dey negative, you go take the vaccine, and once you take that vaccine, e go protect you from being infected. You understand? Because the infection na through blood fluid and blood wey dey infected by the virus. But wetin dey even surprise me na say government don do some kind of awareness campaign, they don do some kind of programs to ensure say people dey aware of am and all of that, even vaccination and the rest. But e be like say their effort no dey enough, because I don see am say the prevalence rate for rural areas and even for some cities dey very high. Some people no even know wetin be hepatitis, not to even talk about the modes of transmission and how to protect. In fact, they no know anything about am. So I take am upon myself say make I meet with one young man wey don help medical facilities, don give them some kind medical support, that is for through he don support them through his services. You understand? They dey conduct awareness campaign, they dey do testing, they do vaccination. The man has done a lot. So I say make I go meet am, make I hear, so that we go hear more about this hepatitis, wetin e be, wetin we need to know about am, how we can go about testing, vaccination and the rest. So make una stay put while I go meet this young man, make I get one-on-one chat with am. Thank you. Mr. Owara. I've been searching for you.
Thank you.
Yeah, I left you in Ebonyi State.
Yes, I am.
Yeah, so I just came to say hi to you.
Thank you so much.
And have a one-on-one chat.
Thank you so much. No. Yeah, so I thought being Sunday, you had other stuff to do, but
No,
thank
I
you
had
for
already
coming.
made up my mind.
Thank you so much.
I must meet you.
Yeah.
I'm
I'm
last
glad-
time I was in Calabar,
Okay.
I tried to see you, but I learned you were very busy. And then finally, when I left, I couldn't see you. So when I was informed that you're in Ebonyi, I said, there's no way to be in Ebonyi and I won't come and see you. So what's really happening now?
Well, now it's hepatitis matter.
Yeah, that reminds me. Why did they call you? Maybe we should use pidgin English. Why did they call you Mike Hepatitis?
That matter tire me. I guess it started it didn't start for Abuja. Because that time I was, I think they worry me how we don't take raise awareness, what you want to, we go from one radio station to another radio station, we do every media house, we just engage. So a lot of people now can't sabi me.
Okay.
Can't they save my number as Michael Hepatitis.
Okay. Talking about hepatitis,
Okay.
because I like my viewers to understand what hepatitis is all about, and then the mode of transmission, how one can be tested, vaccinated, and if you're already infected with it, how do you live your life, what do you need to do, and all of that. Because it appears that because the prevalence rate is very high, which is the next question I would like you to answer. Why is the prevalence rate so high, even when government is, coming out with awareness campaign? They've carried out some programs, to educate people about it and all of that, but it's still on the increase. So, first of all, what is hepatitis, modes of transmission, vaccination, and the rest? Then, why is the prevalence rate high?
Let me focus on hepatitis B and C, which is a major public health concern that we have in our country today.
Yeah.
Now, hepatitis B and C primarily affects the liver. It's a virus that affects the liver.
Okay.
And it is transmitted sexually from a mother to a child, from a mother who is infected to her.
Please, can you use pidgin English?
Okay, so hepatitis B is a disease where they affect the human liver.
Okay.
And you know how important the role of the liver plays in the human body.
Yeah.
So if you get hepatitis, when mama will get hepatitis born pikin, and the mama no do wetin she supposed do, so that the pikin no go get hepatitis, like wetin we dey call prevention of mother to child transmission. Then sexually, if you sleep with person wey get hepatitis without protection, you fit collect hepatitis. Do you get? And that's so hepatitis takes spread for our country because the awareness be no day. Awareness no day. And one of the major reasons why it makes the awareness no day, because there's no funding. We don't get funding for Nigeria for hepatitis like we get for HIV, tuberculosis, and maybe even malaria. We know day. So to raise awareness, you will need
funding. No day at all.
There's no funding.
Bata.
No, you know.
Let me say it is small.
You know day. Except with some other organizations where they do interventions, they do plenty. Because to see NGOs come to do something means that you don't give them money to carry out different activities.
Yeah.
And then maybe state ministries don't get budgetary allocation for hepatitis for them to carry out activities. But they. You understand? So even if you want to raise awareness, it will cost you money.
Yeah.
If you want to do vaccination, screening and vaccination, it will cost you money. If you want step up support for hepatitis B and C patients, it will cost you money. Do you understand? So the lack of funding for this matter is the major problem we will get. For us, Nigeria, we get policy. Nigeria gets what we call National Policy on Viral Hepatitis. They get National Strategic Plan for Viral Hepatitis. Now, will be wahala. Now, the funding to be able to drive implementation, now make say the prevalence for hepatitis B and C very high, almost 3 times more than HIV and AIDS in Nigeria. And this hepatitis, they 50 to 100 times more infectious than HIV and AIDS. So if funding no day, awareness no go day. If funding no day, vaccination, people no go day get access to vaccination, and even if they get and they will do out of pocket payment, it will be very, very expensive. One single dose of vaccine and is very, very expensive. So now the matter we try to see the travel from one place to the other, we talk to stakeholders, we engage, we tell them see the matter how the matter is supposed to be. We get some states where we say the prevalence in this state is higher than even the national prevalence. And knowing say no funding, if you want to treat yourself, money will come out from your pocket. To pay for viral load will be very expensive, money will come out for your pocket. So person will not get money to pay for viral load and pay for a treatment. What the person won't do?
So this kind of economy
exactly what the person won't do. So now make we use the hepatitis advocate community to raise awareness and then to do what we call stakeholders engagement. So let's begin to engage stakeholders. We get what they're supposed to make them do them. You understand? We put our word, because if I tell you say this thing day, and this is the risk and the danger, you will get reason why you won't do something to prevent yourself from getting this thing. But if you know, you will just be relaxed. You understand? You will just be relaxed because you know go bother you. But if you know, say okay, it's easy for you to contact hepatitis B or hepatitis C, and then you're now aware that say vaccine D, which is for prevention, you will take steps to get the vaccine. But if the awareness no day, if that sensitization no day, how people will take no? Now what they happen in most of our rural communities where we say hepatitis plenty, because the people know the leaders, the traditional leaders don't even know, the religious leaders don't even know. We don't even have doctors, maybe specialists in that field in all the local government. Most of them are in federal teaching hospitals. And for our country, we never do it in a called step down training to make sure say any doctor who see manage hepatitis patient, it no dey like that. So wetin we dey see for field say patient dey placed on wrong treatment, wrong medication by some person wey no suppose do so because the training never did. So if you look this whole matter, say you understand, say this thing still boils down to a lack of funding.
My brother, now wow, as serious as this matter dey.
Serious.
You have been saying HIV/AIDS be the ogbonge sickness before. Now recently now I can't find out, and then recently now find out saying hepatitis even dey more infectious than that one, and that one self the wahala too much.
Sure.
You can say it cause inflammation of the liver.
Yes.
And I even get research where I do. Come see say Federal Ministry of Health say 20 million Nigerians are infected with the virus. But as it be now, what will be your advice to to people, especially my viewers when they watch, and Nigerians, at large? Because as it stands now, I don't see say government efforts not there enough. Because I dare always say them today do some kind of awareness and all of that. NGOs too, they don't try. But it's here now say the thing still they serious. So I want to ask, within some individuals, because I believe say as people they watch now, some of them go they wonder how can they come in? Within they feel contribute. Some go even to say I know get money like that. Now people will get money that then feel support in one area or the other. But one thing I know be say one-on-one campaign e dey now. I be that one no dey. So I would like make you advise my viewers how they will protect themselves from this sickness. You don't already talk one. You say through vaccination, and it be like say this thing no get complete cure. If you don't dey infected, now just treatment to manage them. No be so. The only sure way na vaccination.
Sure.
Okay. So I like make you advise my viewers how they go do.
Okay.
And if they don't get them, if they don't already get them, what thing they need to do? Okay. Because some people, if they go run tests now, can't see they get them, they feel no know how to contact you to tell you say see. Because like you talk now, I don't see say if person go direct to hospital, they feel help am more, but you go spend plenty money. But like you now, we be say you they help people. How you go feel assist, or what will be your advice?
Okay. First off, make I talk to your viewers.
Yeah.
My people, na Naija we dey. I dey talk to you as person wey dey live for Naija. All right. Wetin I want make you do for me be say make you go carry yourself go do hepatitis B and C test so that you go know your status. If you do your hepatitis B test and your results come out as negative, thank God for you. Get vaccinated immediately. There are 3 doses where you're supposed to take of that injection. It's called hepatitis B vaccine. It will give you immunity against hepatitis B. You no get vaccine for hepatitis C. The prevalence also is very, very low. But if your test come out and it shows say you dey positive, no wahala. Is it better make you even know say you get them early? Because if you no know say you get them early, that's why it's called the silent killer. If you no give you signs say you get hepatitis and you didn't do your body for years until it go come cause what you call liver cirrhosis, it will come cause liver cancer, and if you no manage them well, now die with that. So if you know say you get them, just walk into any federal teaching hospital, say you want to attend the gastro clinic, where you'll be able to see a ogbonge doctor will be gastro, will be able to manage you, will tell you what you're supposed to do. And in most of these hospitals, they help them to do the viral load test because it's very expensive, so that they can do it at a subsidized cost. Now they're waiting the matter, so make you no wait until say government carry the matter come you, or person carry the matter come. As I don't tell you like this, make you carry the matter go meet your family. Tell them about hepatitis. Carry and go your workplace. Tell your colleagues in the office about hepatitis, because currently there is no family in Nigeria that is not directly or indirectly affected by viral hepatitis. So if you do your part, me I do my part, all of us will be able to save our lives, and then we'll stop this further spread of viral hepatitis in Nigeria.
Okay, well, I would like make you still give our government advice.
Okay, for my advice to the government is very simple, especially to the state government, because I feel like there's a lot state governors can do, which is to leverage on existing infrastructure and programs to be able to reach more people. One of those things is the fact that every state has a media house, a radio station, a TV station, right? So they can actually activate the state media houses and the state TV stations to begin to intensify sensitization awareness about viral hepatitis in their respective states. And this is not going to cost them so much. It's something every state can do. And then in almost all the states, we have what we call the HIV program. So we can actually leverage on the HIV program to be able to extend hepatitis care to people, even in remote communities. Primary healthcare centers can actually do a lot in terms of screening and counseling of mothers who are already infected, right? And then knowing how to refer an infected mother to another facility, maybe a secondary facility, to be able to access care. So these are the things that the state can do. And then another thing I'm going to also advise is that state governments should start making budgetary provision that is focused on hepatitis. Most states don't have it. So they have no activities about hepatitis. Nothing is happening because there's no budgetary provisions in their budget for a particular year, and it's been on for years. So if a particular state, a Ministry of Health can say, okay, this is what we want to do for this year in viral hepatitis, and it's included in their budget, then the ministries of the different respective ministries of health in different states will begin to carry out activities, interventions that will be able to give people access to professional care.
Okay, so I learned you've been partnering with medical facilities,
yes, sir,
rendering some medical services like that as it pertains to hepatitis.
Okay.
How do you do it, and what are your challenges?
The challenge boils down to funding, because to give people access to hepatitis B screening and vaccination is a lot of money. The vaccines are very expensive, and then you have to subsidize so that at least people can have access to it. And in most cases, we take over the entire funding of the vaccination. Maybe the first dose is completely free, and that's a lot of money. And you're reaching people in numbers. But the second aspect is that, okay, people are in different places, so we look out for facilities that we can extend and support to be able to give that service to people. So that we do, so that you can easily walk into a facility, get screened, and also get vaccinated. Then for federal institutions that have molecular labs and they have the PCR system to run viral load tests, so we take over the procurement of the reagent, because the reagents are very expensive. Very, that's why most of them don't want to go into it. Because so we now take over the procurement of reagent. That way you'll be able to crash the price of viral load, because viral load in some places is about 60-something thousand naira. How many patients can afford it
in this economy?
Exactly. How many patients can afford it? So when we take over the procurement, we're able to bring the price down. And because that test is very critical in a gastro managing a patient, it's almost impossible to be able to manage a patient without a viral load test. Do you get? So we are doing that so that it will be easy to move patients from the point of investigations, consultation, to now look whether you're doing treatment or we're going to place you on monitoring. That is something that we do. And even in some of these facilities, we do what we call patient follow-up and contact tracing. That means when you don't see doctor, we'll follow you up to see doctor, we'll follow you up to do investigation. Because most of them, if you follow them up like that, they will disappear.
For such way, that's
a human tendency. That is what, because number one, you have it, but they cause you any physical discomfort. They give you pain. Yes. So the tendency for you to ignore them be very huge. You understand? So you go ignore them until the thing go now shoot. At that time when you don't shoot, you're gonna have what we call inflammation of the liver. You start losing body mass. Jaundice of the eyes when the thing don't reach that advanced stage. So it's most of, if malaria do it, because malaria not gonna let you day okay, you'll not be very, very comfortable. So you want to go and get drugs immediately. But this one, that's why it's called the silent killer. So it doesn't really create any kind of discomfort until it gets to that advanced stage, and we don't want it to get to that advanced stage. That's why we're making it easy, and we're saying it that people should go out.
So you follow up, like you call them,
and that is a lot of money. Yes, it is. It is. That's why when people tell you, Michael Hepatitis, you carry this matter for your head, you're everywhere, I'll just laugh, because the people feel like we're doing a lot. I don't even think we're even doing enough. Because when you see the pool of patients, over maybe sometimes 70% of them will not have the money to do basic investigations. They have their own challenges. And then there are some states that also allow for what do you call? I know at some point we have suggested that okay, health insurance should be able to cover for most of these things, but it doesn't cover for most of the states, and most of these patients are not under any kind of insurance cover. You get to be able to handle the expenses and all of that. So the issues are enormous. So when people feel like, oh, you're doing a lot, I don't even think we're doing enough. Looking at the burden of viral hepatitis in Nigeria, we're not doing enough. We're not doing enough because we need to step up vaccination. We also need to make it easy for people to have access to professional care. That way we'll be able to stop the further spread of viral hepatitis in Nigeria.
Wow. That's very interesting. It has been a wonderful conversation with you.
Thank you.
In fact, Mr. Iwara, I must commend you. You've really tried. You've really contributed your quota. I know. I always say, when it comes to hepatitis, it's not just a government thing.
Sure.
All hands needs to be on deck.
Sure.
Whether the government, NGOs, individual, churches, mosque. We all need to see how we can really contribute our quota, because if this thing continues like this, it will have a serious effect, even in the economy.
I agree.
Do you understand?
I agree with you.
So I'm really delighted to meet with you and to really have this wonderful insight.
Same here.
I want to encourage you, and I also want to tell you that God will bless you for all you're doing.
Amen.
And do not be discouraged, because sometimes when challenges come like this, it sometimes has a way of weighing us down, you know. I believe the next time I'll meet with you like this, I'll hear good news. In the sense that you tell me that you've covered the entire Nigeria. You understand?
I'm looking forward to it.
So on my own part, I'll make sure I post this conversation we've had, so that will be a way of me trying to disseminate the information, create awareness. So whatever feedback I get, I'll refer it to you, so that if we might have another session, definitely we'll do. So do you have any other thing to say finally before?
Well, the only thing I'm going to say is I would like our beautiful audience, I want you to join the hepatitis advocate committee. That is something everybody can do. I'll explain to you why that is important. I, as a current national coordinator for the hepatitis advocate community, is actually a community of people who have volunteered to help raise awareness about viral hepatitis online. Okay, so what we do is to develop content. Maybe it's a graphic, infographic or something we put out there, so everybody get to share it on their WhatsApp status, on their Facebook status, on their different social media platform, because they have an exclusive online community. So because you've signed up to become a hepatitis advocate, we are able to have access to your online community by you sharing content. Now, you don't just become a hepatitis advocate, you're trained first, because the moment you start posting content, right, you're going to have engagement.
That means social media has a prominent role to play.
Definitely. It's currently right now, it's the cheapest option, because like I said, if you want to go to radio, as much as we want to do radio and TV, it takes a lot of money, and we do not have funding. So you now have an online community, like I'm talking to you right now, right? Because of your online community, I'm able to reach a lot of people. So now we have hepatitis advocates in different states doing the same thing.
Wow.
And that reach is currently richer than any TV station or any radio station we could ever be on. Because when we post, you have maybe 100 views on your WhatsApp status, on your Instagram story, and all of that, on your Facebook reel. It's going viral. And guess what? It's completely easy and free. So you just wake up in the morning, there's already a message for you to on your phone, just share, and that's it. So it's more like we've completely changed how public health campaigns are conducted in our country, because we had to sit down and design a solution based on how important awareness is. And so the fact that we do not have funding to raise awareness is not enough reason why we do nothing. So how do we extend the messages to people? Now we're even at the stage where we're developing messages in local languages. So if I do a message in your language, right, you that is in Abuja can send that particular video to your mother in the village,
Yeah.
your mother will listen and understand what we're saying about hepatitis without even you having to travel to your village or your community to talk about hepatitis. So we're making the messages very much available and easy for people to disseminate. We're also going to that point where we can now start having Facebook conferences about managing hepatitis and all of that, because we need to raise awareness. It's very critical that we do that.
Wow.
Yes.
That's very interesting.
Yes, it is.
Ladies and gentlemen, that's been your boy Imailom here, and I just had a one-on-one chat with Mr. Iwara. Mr. Iwara is the national coordinator for hepatitis advocate community, and he's also the head of program St. Collins Iwara Development Initiative. Please help me like and share this video. Let it go viral so that others will also hear and know what hepatitis is all about. Thank you so much. Till we meet some other time.
Thank you. Thank you.